Artist came over one day and saw it. Yeah.
Ready, Sally?
Brought a plate of goodies.
It's 5:15. I'd like to call this regular meeting to order. I'd like to recognize everybody in the audience this evening. Would you please stand and recite the pledge with me? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Moving on to school board norms. Jennifer?
The decisions will be based on the board's strategic plan, its mission, and what's best for students. The board will act as stewards of tax dollars. Board members will complete foundation work to be prepared for the meetings. The meetings will be efficient. All perspectives will be voiced and heard. All board members will maintain a professional decorum.
Thank you, Jennifer. We have no public communications. Is there any conflicts of interest to declare? Hearing none, moving into consent agenda. Motion to approve.
So moved.
Motion by Jennifer.
Second.
Seconded by Diane. Any discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into our regular meeting, we have nothing under recognition or correspondence. Moving to reports, student council report. Bailey's here. I think the button on the side there.
We just got done with Snow Week this last few weeks, and we always do dress-up days for Snow Weeks, but this year we did it a little differently. We let the entire student body decide. We had a box sitting outside the Jay's Nest, and we let them pitch their own ideas, so that way every single idea came from a member outside of the council instead of inside the council. On Monday of Snow Week, we had the coronation and the variety show. Variety show went very well. We had 11 acts, I believe, and that's one of the most we've had in a long time. And then the pep rally, we did something new this year. For prom, we did a fundraiser. The student council we put our faces alongside the lunch line, and you could buy one pie for $1, and whoever had the most pies got pied in the face at the pep rally. And it was just a fundraiser to help fund for prom. Next thing I have here is the dance. The dance went over really well. We probably had 100 students show up to the bunker. It was a great time. The only problem was we didn't have enough water for everybody, so we had to go get some more. And then coming up here, we have Morp Week. That is the 12th through the 16th of March. We have Mr. JHS on Monday, and then we have our annual dodgeball tournament. And then we end it with our last dance of the year on the Friday. And a couple other things we have coming up are we have a couple service projects, one being the blood drive that we do every year. That'll be April 18th. And then we have another one that we've been talking about for the last couple of years that's in the works here. We're hoping to finally get it done this year. And then the only other thing we have is elections are coming up here. Beginning of April is the executive board elections, and then beginning of May is the regular council elections. Any questions?
Any questions, Rebecca? Diane?
How did it go with the suggestion box?
It went over really well, actually. I was expecting maybe a few more not appropriate things, but there's not too. They weren't bad. I'm going to be honest. They weren't bad at all. It went over pretty well, so it was good to get some input from outside the council.
Did you use any of their suggestions?
All of them. Yep. Every single dress-up day was from outside of the council this year. Yep.
Any other questions? Not, thanks for coming.
Yep.
So, it's always good to hear from you. Moving on, superintendent's report. Rob?
Bailey, before you leave, congratulations, state hockey. I have a few things written here in my superintendent's report. I'll touch on just a few. The first, the Striving Readers Grant. I've talked previously about that, and just to kind of reconnect you with that, that grant, $28.8 million grant through the state of North Dakota, a sub-grant through a federal grant. There is some pretty significant requirements that are a little bit different than grants that we've received in the past. The biggest being there is a birth to 5 component. And again, striving readers, obviously this is a literacy-based grant. And that birth to 5 component means that we are needing to reach out with a broader community than other grant opportunities that we've had in the past. And so we have been meeting with what we're calling a literacy team. And just to back up a little bit too, the framework for this grant is a little bit different also, because we are currently drafting a letter of intent, or what's called a letter of intent. It's sort of like a mini grant application. And so we write this letter of intent, and it's much more than we're intending to apply. You know, it's a pretty substantial process by March 1st. And they will read through those, and then by March 15th, list finalists. If you're a finalist, that means that you're going to receive grant funding. You just have to go through the full grant application. Okay, so there's a couple different stages. And so what I think is important to know about that is if we were selected to move forward and receive a grant, we would then add on a much broader committee of, educators, principals. Right now, our literacy team is focused on those that are writing this letter of intent, and then the birth to 5 partners that we have. Again, this is something that's a little bit outside of what we do every day, so we need some help, and we want to partner with those entities. I think Jamestown is in a unique situation across North Dakota with this grant. We are large enough to impact a lot of students, but we're also small enough to be able to partner with major partners in early childhood, but also provide some slots and availability for all those that provide either pre-K services, child care services. So I think we're kind of in that unique spot. In a larger district, you aren't going to be able to service everybody or provide options for everybody. It's just not feasible. And in a smaller, you have fewer options. There's fewer kids impacted. So I think we're right in that, what I would consider that sweet spot to be able to apply. So as we've looked through that birth to 5 component, our intention is to target specific partners, but like I said, open that up for other providers to receive some of that benefit also. Some of the things that we've looked at thus far in the working with monthly literacy day camps, varied by age levels. This would be for those that are likely not in a child care setting, maybe those parents that are staying home with their children and still can have access to some literacy instruction. An interesting idea came through from this executive committee also, coordinating with healthcare community and tie-in literacy supports and understanding of future programming for expectant mothers. Pre-K Reading Corps, we use Reading Corps in our elementary schools now. Pre-K Reading Corps would extend that to the pre-K services throughout Jamestown. Professional development, of course. Upstart is a cloud-based literacy readiness program, which could be used to support those that either are not receiving pre-K services or that need a little bit of extra support. Imagination Library funding, which we know is already operating and doing very well in Jamestown, but that is something that's fundraised, and if there can be an opportunity to support that, we think that would be a very useful way to do that also. And then provide nurtured heart training for those that don't have it. That is what we use K through 5. That would be a nice bridge to what's already taking place and provide some consistency in terms of school culture. Grades K5, 6, 8, 9, 12. I listed a few different things that we've talked about. Comprehensive literacy engagement training, learning walks focused around literacy, instructional coaching that supports literacy, increased technology, summer work sessions for staff, literacy and writing, replace our secondary screener. Currently, we use Dibbles and the Easy CBM with FastBridge. What I think is interesting about FastBridge, while it is a little bit pricey, it does include a social emotional component. So as you're assessing in those areas that Dibbles has covered the academic, it's also giving you a little bit of information on the social emotional learning that we know is important also. Enhance activities to address summer regression. We know that that's obviously an issue. Support 21st century literacy and writing adaption through the implementation of a learning management system, and then additional English language learner support. Were the ideas that we've worked through thus far. A lot of work to be done between now and March 1st. It feels like that's a lot of what I'll be doing between now and March 1st, but we will get that submitted and hopefully hear good news back on the 15th. So questions on that?
Jennifer?
Not really a question, but just a statement. I wanted to commend you and the executive committee for not backing away from this grant, because it is asking you for something out of the box. And I know that there's probably some districts that looked at that and said, we have no way to do that. We have no way knowing how. And they probably just decided not to apply or go through the rigors to try to make this work. So I commend the executive committee and yourself for putting our name in the hat, working hard, and figuring out what those partnerships would be to make that birth to 5 cohort work. Good job.
Thank you. I think it's it would be a lost opportunity. I think if we didn't pursue it, and maybe it isn't something that we get lucky enough to receive, but I think we've learned a lot through the process too, so that I think helps us. So thank you.
Diane, you had a question also?
Oh.
This might be one that Mr. Toso can answer. I was wondering how many families we're reaching in Stutsman County with the Imagination Library now.
I don't know families. It's the last that I checked, it was 499 kids. 499. Yeah.
The last thing that I had that everything else we're going to deal with in some capacity in the agenda, but we were part of a shoe drive that took place through a few different individuals, most notably Kelly Rachel and Sean Johnson. Sean from the University of Jamestown and Kelly Rachel from Unison Bank. Samaritan's Feet's a nonprofit company that provides shoes, athletic shoes to students in need, and we served about 150 pairs of shoes, or 150 pairs of shoes were given to students in Jamestown. About another 30 were given to kids from the surrounding communities. I think it was a great, I went down there, spent a little bit of time, really a pretty cool opportunity, and something that it was, if you think about 180 pairs of shoes in your community, that's a lot of pairs of shoes to give. And so we're very thankful to Samaritan's Feet, to the University of Jamestown, and I know that our counselors and our teachers did a lot of work too in making sure that those forms went home, and to reinforce with some families if they needed that service. So that was really a pretty neat experience. So something we look forward to partnering with again in the future. But that's what I had. If there's questions on anything else that's in the written report.
None? Okay, thanks, Rob. Moving on to our board education, we have the Near Sight Clinic, Dr. Rashad and Randy Johnson. Come.
My name is Randy Johnson, and I am the benefit consultant for Jamestown Public Schools. We were hired about 3.5 years ago, I think, is time frame. And one of the things that we discovered in our initial discussions with the school benefit committee was some of the issues relative to access in the community for healthcare services. So I went on a little journey and met with the hospital and Sanford and Essentia and the community health center folks, and tried to understand exactly what was occurring. And there seemed to be a common thread that the availability of some services timely was not existent here to the degree I think that the expectation is, given our great healthcare system we have in America, so and that we see in other marketplaces. So we went and initiated a process for many of our clients. So just so you know a little bit about Hayes Companies, which I'm a part of, we have about 5,000 employers that we, both public and private, that we consult with throughout the country. And we have many of these clients who are engaged now, and even more so now than ever, doing what we call near-site and on-site clinics. So employers are actually building their own clinics right on site, or they contract with providers that they have a relationship that are in close proximity to where their employees are located. And they're doing this for a multitude of reasons. One of them, obviously, is they're looking for a cost opportunity, but another reason is they want to provide it as an employee benefit for just providing access to clinical services without barriers, whether it's a cost barrier or time availability of barrier. It all has to do with the quality that happens to a patient experience. And I don't want to speak as a clinician. Dr. Rashat can certainly speak to that side of it, but we just see it from our element that we're trying to manage cost for clients, as well as improve the outcomes of patient opportunities. And so I've got just a few slides I'm going to show you here quickly that reflects this process. So we did a request for a proposal to the market. These are some of them that were invited. Essentially actually came and met with the committee, I want to say a year and a half ago, 2 years ago. It was our first meeting that we had with them. Care Here is another vendor, Marathon Health, HealthStat, QuadMed, Paladina Health, and Medalis. So these were all the vendors that we went to in their various parts of the country, and these vendors, what they do is they come and provide a turnkey service solution for employers in managing these clinics for employers. So we also collaborated with the hospital in the RFP process, just so they're aware of what we were doing, Jamestown Regional. And then we contacted other employers in the local market just to get feedback. But we also, just so you know, met with Sanford as part of it too. We had a meeting with them. And I'm not going to read all these things, but we do a background evaluation. We set very strict criteria for who could be considered in the scope of clinical services that we expected, as well as the vendor qualifications, because they have to have both administrative and clinical capability. So we shared all this process with the committee and then went out to these vendors and allowed them to respond. Well, what happened is we got a declination from every one of them because it had to do with size. In order to have an employer on-site clinic capability, the minimum threshold that most of these, to make it work financially, is you have to have at least 500 employees and approximately 1,500 members. So that'd be dependents. Well, Jamestown Public Schools is smaller than that. We're about 266 or thereabouts and about 600 lives. So Dr. Rashat, who's actually where, even though Hayes Companies is based in Minneapolis, that's our corporate office. I work out of the Salt Lake City office, and Dr. Rashat provides this similar services to what I've just described in the Salt Lake City market. So I went to Dr. Rashat and said, here's what the proposal is. Would you be interested in bidding for these services? Even though it's it's not enough, big enough population to a typical environment, would you be willing to entertain it? And he came back and said, I would be willing to do it if we could do not only just the primary care services for the school, but also offer urgent care to the community. And he's going to speak to more of that in a minute to describe what that means. But this is kind of the scope of what we try to do within an on-site clinic. Our objective is to reduce healthcare claims cost, identify threats of chronic illness, increase productivity, because we want to be close. One of the things about productivity is being able to have patients come over, not just as a walk-in. That's important, but they can schedule right into the clinic, because the way that this is structured is primary care is going to be available predominantly for the employees of Jamestown School District and all their dependents. So it's really focused to provide that availability of time slots as a priority. And And then we also, and it's important because this one right here where it says no cost, that's a big deal. So now the school district employees and their dependents can come to this clinic at absolutely no cost. There's, we're scheduling it as no wait times for these employees. Access to wellness programs. This is another important element. We want to be proactive with preventative care. So there are several program structures related to not just treating clinical care, but also for wellness initiatives. And then, it's a trust factor. Getting to know certain providers as it relates to more of on a personal basis is a large element to this program as well. So this is the proposal that came through was, designed to accomplish these things here: identify risk, identify the risk, mitigate risk factors, change utilization, and capture the value. So that's a component. The provider approach is much more time. The average is between 20 minutes, but on average, it could go, beyond a 20-minute visit without feeling, like you're pressured to see a patient. The normal environment is around 10 to 12 minutes with a patient in today's medical environment. So that's the other advantage of having this type of experience. Then this is the services that are being provided: primary care, urgent care, and then we are introducing the telemedicine solution that is at no copay cost to the member. In the summer, it will be available to the employees as well as an expanded service. There is one thing that I do need to. There's this particular outline that I've described here. There's one slide missing. And I need to, it's actually the slide where we show, or maybe I'll just do it this way instead of trying to get it on here. Do you want to describe what the outline of the clinic space looks like? Because the slide that was on there is not there. It got, when I put in on this presentation, apparently I put the old presentation instead of the new one. So if you want to just describe the spacing on it.
Sure. Just a quick history on Dallas Medical. We have been operating and providing care in Salt Lake City since June of 2000, so 17 years, 18 years now. We have 8 locations. Our motto is urgent care and primary care billing insurance for our revenue. In the past 7 years, we were able to add on a program that would allow employers to provide care for their employees at no cost to them. We have over 100 companies in the area that use our program for the employees. That's why we're able to do the same similar model here. It's a basic clinic membership program that employers pay for the monthly fee for the employees to access the clinic. So we have 8 locations. The size ranges from 4,000 to 5,500 square feet space. Has multiple rooms and multiple services that we provide. So for the location in Jamestown, it's 3,000 square feet, and I'm very excited to share that with you, the floor plan, because it can fit 7 exam rooms, as well as an area for suturing, orthopedic area, and cardiac area, as well as a X-ray room. So you have a very efficient clinic that can provide services in urgent care and primary care area. The clinic can easily handle up to 50 to 100 visits a day. Our record day was 112 patients in a 2,700 square foot space back in a few years back in Salt Lake City. So the way that we provide care is very efficient, both in urgent care and primary care. We try to focus on not having the patient wait too long, either in the waiting room or in the exam room. At the same time, they get adequate attention when they are there. Our job is to detect what's wrong with the patient in front of us and do something in the clinic right now so that they have symptom relief before they leave. So do you have that slide?
I'll get it. Good.
Oh, okay. While he's getting the slide, I'm gonna just tell you. So for the urgent care services, it opens from 7 a.m. to 7 p.m. 7 days a week. For the school district employees and their family, they can walk in at any time during those 7 days and those hours. If it's between Monday through Friday, then there's no copay involved. And then if it's on the weekend for walk-in urgent care services, then we would just collect the copay and bill insurance for that. Okay. And for the primary care, you can call and schedule an appointment from 7 a.m. to 4 p.m. on Monday through Friday, and also the first half of Saturday from 7 to noon. So those are scheduled visits, and there is also no copay for those visits. As far as urgent care services, we're able to take care of acute illness and injuries. Okay, if you have sore throat, fever, bronchitis, pneumonia, that's needing antibiotic, breathing treatment, even IV fluid, we can perform all of it in the clinic. As far as injury, cut, sprain, broken bone, most broken bone and most sprains are simple. Most lacerations are simple. We can take care of those. You can just walk in at any time for that. We have X-ray on site. It's digital X-ray. We read it right away, and we have a radiologist group validate the readings within the same day. So as far as primary care, you call and schedule for appointment, and with that, we'll be able to provide annual checkup, well baby check, as well as chronic disease management, like hypertension, diabetes. Those are the disease that will be best served if you call for a slot on an appointment basis. But if you do need to have medication refill and you can't get in and be scheduled in the same day, you can also walk in and have the medication refilled in the same day, and then do a complete follow-up with a scheduled appointment sometimes later. So.
We'll get to it. So now I'm going to cover this part.
Oh, okay.
But we'll slide back to the outline. Just so you know, this is the economic model, and I wanted to bring this up because this is important. One of the things that we did in our analysis, and I apologize, I've got copies of all this that I'll pass out to everybody. This is one of my unfortunate ways that I look at data. I look at data in a very deep way, and I think people on the committee would know that that's one of the things that Hayes does a lot. We have to validate, the opportunity. So what I did is, just to give you in the simplistic terms of analyzing the economic proposal by Dr. Rashat, was we took all the procedure codes that happen in a primary care setting, and then we compared that with the trend that's happened in the last couple of years. And this was one of the other reasons that we looked at this. And you can't see it, but on the bottom it says in 2015, the average cost of a primary care visit in the market was, or for Jamestown public employees, was $139.09. In 2016, it went to $169.97, or a 15% increase. In 2017, it went to $187.18, or a 17% increase. That's just on professional services. That's lab and consults. So that is a 32% increase in a 2-year period. Well, my colleague that I work with, we were kind of going over this a few months ago, and we were startled at the increase, first of all, and that's one point. The other point is, now we had to say, if based on the proposal of Dr. Rashat, what was it going to be going forward with the model? So let me explain to you how the model works, and it's important. So it's basically the school district is sharing part of the rent, which is about $1,300 a month. Then they're also sharing the initial kind of development structure of the clinic. Normally, a clinic this size, you're putting $250,000 into it. The school district is putting $25,000 as a part of it, plus the supply setup, which is about a $10,000 setup component. So those are what I would call like the sunk cost, the startup. If a normal employer, like I'm working with an employer right now in Utah, that they're putting in almost $500,000 in just to their clinic. So that gives you the idea of what, it is expensive, but this is a prorated share of the cost to start it. So that's important. Then the cost going forward is, again, a portion of the rent. And then the administration fee is $18 per employee per month for Dr. Rashat and everything his staff is doing. Any other costs beyond that have to do when a patient walks in the door, and it's only a prorated cost for the hourly wage to cover a provider, which is $70 an hour for the provider. And then all the lab cost and overhead, which is $44 a visit. So there's, or x-rays, whatever's being done, that's a fixed cost. If you were to do that fee for service, I already shared with you the numbers that equates, to. So when we assumed that about 65% of the employees and their dependents would be using the clinic going on by within a year period of time. And if you were to back out the pharmacy component of it, so we want to compare apples to apples, the average cost for Dr. Rashat's program is $131 instead of $187. So it's basically $50 less per visit. It's pretty substantial. And the other factor that's not taken into consideration with that is that the idea is we're spending a lot more time with the patient as well. So running this model and this structure, we feel economically it's a great opportunity for the school district and their employees as well. Let's see. So this is what I was trying to get to, and I apologize that we didn't have it up earlier.
Can you make that bigger? Okay, here's the entrance of the clinic, and you have a long waiting area here. You can section it to be a primary care for one and then urgent care for the other. There's 2 check-in windows. This is the office where the medical receptionist and the manager will work. And on one side of the clinic, you will see on this side here, you have 4 exam rooms, okay, that can be used to provide the care. And this 5th area here is the suture area. This is where we perform laceration and minor procedures. And then on this side, as you can see, there's 3 more exam rooms here, 1, 2, and 3. It also has a cardiac area. Being an urgent care walk-in clinic, we do see some patients that walk in with chest pain, respiratory distress. This is where they would go. We would have oxygen and basic equipment necessary to stabilize them while we're calling 911 to transfer them to the hospital. We don't do anything more advanced than that. And then this area back here is an orthopedic area where we would do splinting and casting of the patients. Around the corner, while we're there, is the x-ray area. So the x-ray room is situated here. So back to the center of the clinic would be 2 counters where the medical team will be operating. You can say that one side is for urgent care and the other side would be for the primary care. We have, by the way, we have retained, we're fortunate to be able to retain Roxanne Johnson to be the primary care provider of the clinic. So she'll be your public school primary care providers. She joined us here. So, Roxanne is right here. So after I finish, maybe we'll have her say a few words here. Then right behind this working area would be the central lab where we would perform, simple physician labs like strep tests, influenza tests, urinalysis. We do blood draw here as well. And then back here, just 2 restrooms, laundry area, and then staff break room and storage is back here. So this whole entire space is about 3,000 square feet, and we have total of 7 exam rooms and 3 trauma area and x-ray So, and the lab. Any questions so far on the floor plan? Okay, great. Roxanne, can you
Roxanne, do you want to?
say a few words?
I can, I guess. Some of you I know. Some of you, maybe not so much. I had 3 kids that went through the Jamestown Public School System, and I think the last one graduated in 2011, so that was kind of a while ago. Anyway, so I'm an empty nester, except for my 2 dogs and my husband. I'm a local person. I grew up in Wimbledon, North Dakota, so I know Amy from years and years and years ago. I went to Jamestown College and got my nursing degree there. Then I worked at the state hospital as a nurse for about 15 years before I went back to school to become a nurse practitioner. I worked at the state hospital an additional, I think it was 10, 11 years, somewhere in there. It was almost 25 years that I had worked at the state hospital before I decided to make a change. For the past 5 years, just a little over 5 years, I've been working with Essentia Health, and I've been working in Valley City. So I do still live in Jamestown, so I've been making the trek back and forth every single day for 5 years. So this opportunity came up, and I've been in family practice for 5 years and feel really confident with that. In addition to that, I have a lot of mental health experience. I have a lot of patients that are seen at the Human Service Center, and for whatever reason, they can't be seen there anymore, so they've come over to Valley City to see me. I've had other counselors that have referred patients to me for medication management, so I'm pretty confident in most of that, and just look forward to making a change and helping to keep the Jamestown school system healthy.
Thanks, Roxanne. Any other questions that you may have? Anybody here? No? Yes?
This is 2 basic questions. I'm not clear on how the economics work, that there can be no copay, yet the premiums for our employees aren't affected. And he mentioned a monthly fee.
Yeah.
Okay. And then the second question is, if you have 65% of the employees by the end of the first year, I still don't see that, just common sense-wise, being enough to fill the clinic. But I'm sure you've run the numbers on that many times.
Yeah, we did. Yeah, but good questions, though. So to start off with, in terms of how it's derived on the whole basis of it, I'll go back to, if I can get to it, backspace here. So to try to walk you through this model, we put in here at the very top, I don't know if you can see this, but it's 270. We used the number 270, which was last year. We looked at the cost. Another part of this model is that we look at your pharmacy cost, because we will be able to dispense basic things within the clinic that can offset some of the pharmacy costs that you have as well. But let's just stay with primary care, because that's the focus. So essentially, what we did in this model is took the number of visits that happened in a calendar year at 100% of your volume, which were approximately almost 2,000 primary care visits. Okay, we used and we used the basis of what that cost, using all the procedures that were done at that with all those visits that occurred. Okay, which was over $400,000 basically. Then we said, if we're assuming we're going to get 65% of that, or the number of that is 1,472 visits. Okay, then we're assuming the average time spent is 20 minutes with the patient. So during the course of the year, how much time, based on the hourly wage of these individuals now that we're going to be just paying fixed cost for on a 20-minute visit for 1,472 visits during the year, what does that equate to? Well, time-wise, we have to have so many hours allocated to each staff individuals. So we're shifting the whole model, basically, from saying fee for service to now just fixed costs for labor. Does that make sense? And when we do that, now we eliminate all the other costs that have nothing to do with just pure labor costs. Okay? It's more efficient. That's the bottom line. It's more efficient. Yep.
Thank you.
Yeah, and this presentation that just got passed to you, that there's really two pieces there. There's the flyer, and then there's the detail of what I'm just going through on this presentation. But one of the things that we'll be doing on our side, because our job is to manage, to make sure we're hitting those objectives, right? So we will be looking to ensure that what's being projected will be the metrics that will be looked at as the clinic does have a bigger census and what it's going to be in a year from now, and we'll look at it, retrospectively as well to make sure we hit those numbers. Any other questions?
None? I guess not at this time anyway, so
Okay. Thank you very much.
thanks for coming and thanks for the information.
Roger. Just a comment. This is something that has been discussed essentially by the Health Insurance Committee for years. Not something that is being jumped into, something that's been well-researched, discussed. And I've said this before to the board, our Health Insurance Committee probably knows more about health insurance than anybody else that I know, certainly. And they work very hard to make sure that this fund and the programs associated are well-run and they do very well. That committee should be recognized as doing a great job. I know from the board, Jennifer and Bob serve, Sally and I serve, all as non-voting members. And I hope, help me not forget somebody here, but we have John Lynch, Emma Mickelson, Heather Rohr, Ken Ani, Fran, Teresa Olson. I feel like I'm missing. Oh, Lee Hintz. Am I missing anybody? I got them all. They do really an amazing job, and this is something that committee has really explored, and like I said, not jumped into, but explored. And I'm excited. I think this is something that's really very exciting and something that we should be really pleased with, and looking to open in the very near future. And I think it's a great model. It's something that looks at what the needs of our community are and partners with that. And it addresses those needs as much as it addresses the needs of JPS. It couldn't work, as Randy talked about, it couldn't work any other way. Not in a community our size and not in an organization our size. It's really a very unique model, and I appreciate very much that Dr. Ashat has been out here and gotten to know our community so well and our needs of our organization and our school district so well. And then also want to recognize Randy and Hayes. We've worked with Randy and Hayes for 4 years, and it's kind of an incubation place. We bring up some ideas, or they bring ideas to us, crunch numbers, and I think they've been very, very beneficial as a company to help us make the most productive, efficient decisions we can make. So I think this is, like I said, a very exciting thing for me because it has been a long time coming, and it's been something we've looked at and wanted to do the right way. And so it's nice to see that comes to fruition. So just wanted to recognize all of those individuals.
Bob, you had a comment, or?
I'm not sure if it came out clear, and we don't want confusion. The clinic isn't just for Jamestown Public School employees. There is a community aspect to it as well. So I think that's important for the community to know.
Yeah.
And maybe just further clarification too, this is, the district is contracting with Dr. Ashat and Medallis Medical to provide those services. So, those are services provided through Medallis for urgent care for the community. We're partnering to receive those primary care services and other services for the school district. And I think that's an important distinction to make also.
Diane?
I just want to say that it is very exciting, and we're just sitting here. I think some of us that didn't know much about it are very, very, very pleased and very, very, I suppose the word might be stunned that it's working so quickly and it's coming next month. And I'm wondering if the word is out to all the employees. Do people know that it's opening next month and they can start making appointments then? And the other thing I wanted to mention is that I did sit on the Health Insurance Committee for about a year, and I have never sat on a committee that is more balanced, more educated, more proactive, and I truly trust the research that they have done on this and moving forward with complete confidence.
To address one of your questions, yes, the staff's pretty aware of what is taking place. Dr. Ashat and Randy actually came to our staff in-service at the beginning of the year, and we received very good feedback from staff that we're excited about the opportunity, and they've been patiently waiting as building permits and other planning gets made, and certainly well aware.
Anything else, or? No, moving on then. We have nothing under old business, under new business, under activities. Is there a motion to approve the co-op agreement for gymnastics between Jamestown Public School and the Barnes County North School? Motion by Brenda. Seconded by Diane. Any discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. We have nothing under building and grounds or curriculum. Moving into finance, the general fund balance is there for your information. And then also the state foundation projections. I mean, you can read through that for your information too. Okay.
Just a few comments about the foundation aid projection. I just wanted to reinforce, I know that in many of the board you've heard me make these comments before, but I think they're important to talk about again. Sometimes there's a misconception that frozen means the same. And frozen, and when you're talking about our foundation aid formula, means that the per pupil amount stays the same, but there's other dynamic variables that I think are important to recognize. If you look at, 9646, that's our per pupil rate. But it doesn't equate to hold harmless funding, even if your enrollment stays exactly the same. There's other factors, and I know, like I said, I know the board has heard these from me before, but there's other deductions that get made. It's power equalizing. It's about equity. You want to make sure that that as a state, what's intending to happen is that the foundation aid is inclusive of both your state revenue and your local revenue. And so to create that equity, there's deductions that take place. The deductions take place with what they call the local effort. So that's the value of 60 mills, assuming you can levy to that amount. For us, we certainly can. Other districts, as taxable value grows, they can't levy 60, so you get deducted the maximum that you could. But for us, the easy connection to make is that our local contribution is 60 mills. So that's deducted. And then in lieu of contributions, things like telecommunications, county revenue, those types of things are also deducted at a certain percentage. Some are 75%, some are 100%. So you add up those two deductions together, and you deduct them from your per pupil payment. The reason I bring this up is that's really at the crux of the frozen per pupil. Because when your per pupil is frozen and your enrollment is frozen, but your deductions increase, because they do every year, in a general, typical year, that means your actual school payment decreases. So for us, if you look at the projection and compare this year to next year, even though we're at a very stable enrollment, there's a few ADM projected difference, The difference for us is about $240,000 less. Even though the enrollment stays about the same, even though the per pupil amount stays the same, we're not held harmless. We're not held harmless because those equity deductions increase. And so that, for us, again, state and local revenue inclusive of both. So for us, that state decreases and the local increases. That's how the formula works. And so I just wanted to make sure that people were aware of that and understanding on the board. As we go through, level funding doesn't mean a hold harmless in terms of state funding, even in a situation where your enrollment is the same. I would be happy to answer questions on that if you had any. We've included a draft budget, very preliminary. I don't want you to do anything with that other than just recognizing how those changes impact. It is not between now and a preliminary budget that we'll bring before the board to approve, things will change, and so I don't want you to be anything more than that. It's just, this is where we're at right now, and I wanted you to see the impact and the difference between those two as that state funding changes and how that changes our budget. So questions on those things?
Any questions? None? Okay.
Thank you.
Moving on to monthly financial reports. Motion to approve. Motion by Jennifer, seconded by Heidi. Any discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to personnel, is there a motion to approve of determination of appropriate negotiating unit? Motion by Bob, seconded by Steve. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to letter B, is there a motion to approval of recognition of unit? Motion by Jennifer, seconded by Brenda. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to letter C, is there a motion to approve the hire of Paula Grenick as special education teacher at Washington School with an MAMS plus 16, step 18, salary of $78,669.25 for the 2018 school year and 19 school year upon successful background check. Motion by Heidi. Seconded by Bob. Any discussion?
Just a comment that in there I did include, or I should say I mean, somebody else did it, but there's the inclusion of the background information, so thank you, Amy, for Mrs. Grenick, and, we've been including those for new staff that are coming on board. Very thankful to have her, many, many years of experience. We feel very fortunate. I know when Rhoda Young, our special ed director, did the interview, she felt we were extremely fortunate to have somebody of Mrs. Grenick's caliber, so I wanted to pass that along also.
Okay. Any other discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into policy and procedures, is there a motion for A and B? It's approval of the second reading of the amendment visitors in school and the approval of the second readings there. Motion by Brenda. Seconded by Jennifer. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to the next ones, it's letters C and D. It's the motion to rescind the part-time teacher salary hire and the salary schedule and to approve the first reading of the part-time teachers policy DCB. DJB, yeah. Motion by Bob, seconded by Diane. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to the next one, we have EF and the subsequent 1 and 2. It's the rescind recruitment, hiring, and background checks of classified personnel policy DBAA, and then the approval of the first reading of the recruitment, hiring, and background checks for new classified personnel policy DBAA, and then the criminal history, check screen and procedures, and the adjudication system DBAAE. Motion by Jennifer. Seconded by Bob. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. We have nothing under tuition. Items for future agendas. If there is something that comes up, just let myself or Rob know and we'll get it on the agenda. Moving to Roman numeral 5, we have meetings to be scheduled. Citizens Advisory Committee meeting on Tuesday, February 20th at 6:30 in the Thompson Community Room in the middle school here. We have the District School Improvement Committee meeting Thursday, March 1st at 3:30 in the Thompson Community Room in the middle school. Our next school board meeting is Monday, March 5th, 5:15 here in the Thompson Room. We have also the Southeast Education Cooperative Governing Board meeting on Wednesday, February 21st at 11:30 in the conference room at the Governor's Inn in Castleton. Roman numeral 6, remind everybody to do the monthly superintendent evaluation. It's section 1 and 5. And then also to right-click on your adjournment to assess our meeting. Rob?
To make one comment.
Yep.
One comment related to the evaluation. There is a timeline that is being recommended. It is in my report, I think.
If everybody read that, I think that's
So yes.
that's good to go.
So make sure that
Yep.
you're following that and get those last ones done so the compilation portion can begin. Just, we know that there's deadlines
Yep.
to make sure that we get those done on time.
Don't put it off until the last minute. Diane?
Rob, could you comment on the Citizens Advisory Committee? Did you want board members there, or is it just entirely up to us, or?
Good question. The Citizens Advisory Committee meeting now for the first time in a few months to begin some discussions again. We felt we would put it off until the new year, give things a chance. But that is always an open meeting, so any community member, any board member, anybody interested in what's being discussed, certainly welcome to come. The committee will be focused upon, looking again at all of those variables, all that needs assessment data, and looking to bring a recommendation at some point in the near future to the board on a referendum. So getting close to the end in terms of that process.
No further business. Meeting's adjourned.